My name is Dr. Robert Richart, and what I thought we would do today is I want to show you how we adjust some of our patients. I've been in practice now for 30 years, and 30 years ago we did manual adjusting, and that was very popular and it works very well. However, if you ask people who have never been to a chiropractor why they won't go, the most common answer that you hear is because they're afraid of twisting, turning, cracking, and popping. And so for those people, we use something from Sigma Instruments, and it's called the Pro Adjuster. And what I'd like to do is just demonstrate how we adjust someone using a Pro Adjuster. So we're going to go ahead and do that. What I'm going to do is I'm actually going to do an adjustment of the thoracic spine. And the way the Pro Adjuster works, what chiropractors do is they treat what's called a vertebral subluxation. And a subluxation is a vertebra that's stuck, it's fixated, it's not moving freely. What the instrument from Sigma Instruments does is it measures that degree of stuckness. And so we're going to go ahead all right, and so what we've done is we've just tapped the vertebra. When we tap the vertebra, what they do is they vibrate or they resonate. The software within the computer analyzes the vibration, and we get these series of waves. Now the waves to me would be the same as an EKG would be to a cardiologist, and that is that there's data in there, not so much about the heart with an EKG, but more about what's going on with the vertebra. And so what I do is I analyze the waves to determine where I want to treat the patient. I press adjust, and then what the computer does is it chooses how much force to use at what frequency of tapping to create what will result in a painless or near painless adjustment. And so we're going to go ahead and do that. And so I put the instrument against the spine. 6 pounds of force activates it. And it starts to tap the vertebra. When it's tapping the vertebra, it's remeasuring all the information. When the fixation, the subluxated vertebra, is moving more freely, the computer shuts off. And so on our model here, we have one more segment we're going to treat. Just like so. After I've treated the patient, I actually want to analyze it to see if it worked. Okay, and so we check it, and actually we see we have a nice improvement. All the vertebrae are actually resonating close to the same frequency. We see where most of the waves they look very similar to the one before compared to with what we started with, and that's what we do. And so for those people who are concerned about twisting, turning, cracking, popping, we have this option here in our practice. We've been using it for about the last 10 years. It's worked great. Our patients love it. If you have any questions about it, please feel free to give us a call. You can come in whenever you want. We'll actually show you how the technology works. Thanks.